This poster presents the results of my KL2-funded study that piloted an mHeatlh Mindfulness mobile app with caregivers of older adults with cognitive impairment. We know that caregiving can have profound negative impacts on the caregiver, such as increased stress, depression, and anxiety. Caregivers often have tremendous time constraints, which may prevent them from seeking traditional mental health care, which often involves 8 or more sessions with a trained provider in person. In order to facilitate high-quality, realistic mental health care for caregivers, we have to consider alternate delivery models because caregivers often report that face-to-face therapy is not a realistic option given their multiple competing demands. The objective of this study was to determine the feasibility, acceptability, and preliminary efficacy of mHeatlh-delivered mindfulness therapy for anxiety reduction in caregivers of persons with memory impairment. We recruited 58 caregivers from geriatric primary care sites and caregiver support groups throughout New Jersey. The intervention was Mindfulness Coach, an iOS and Android-based app designed to deliver a mindfulness training course. The VA's National Center for PTSD developed the app to provide an engaging introduction to mindfulness therapy. The app provides a training plan with 14 sequential levels, a practice now area with brief evidence-based mindfulness audio exercises, and assessments using the 5-factor mindfulness questionnaire form, and education about mindfulness therapy. The app is free and available for all to download from the app stores right now if you're interested. Look for a little blue leaf icon called Mindfulness Coach. But we used a research version of the app in order to collect back-end use data in addition to the research assistant-delivered survey assessments at baseline, 2, 4, 6, and 8 weeks. The results of our study showed that overwhelmingly, caregivers found the app to be useful and acceptable, with more than 75% of participants agreeing or strongly agreeing with the acceptability and usability scale. The results of our study also revealed significant reductions in psychological symptoms across the board for caregivers. We assessed symptom reduction both in terms of study weeks and in terms of total hours spent using the app. Because our study began recruiting prior to the COVID-19 pandemic and enrolled our final subject during the pandemic, we also separated out our analyses to model the impact of the pandemic on psychological symptoms in our study. The dotted lines in the charts show the trajectory of psychological symptoms for individuals enrolled pre-pandemic, while the solid lines show the trajectory of symptoms for participants enrolled during the pandemic. This study demonstrated that mHeatlh is a feasible and preliminarily effective method of delivering mindfulness therapy to caregivers of older adults with memory impairment.